The more active you are in your treatment, the better chance that you'll have a good experience with the medication and that it'll improve your symptoms of PPD. It's really important to know everything you can about the medication that you're taking so that you know what side effects to look out for. You also have a good sense of whether or not the medication is working for you. And then you also have a sense of when you might need to check in with your doctor again to reassess the situation. There are a lot of really important questions you'll want to ask your doctor. So when trying to decide which antidepressant is the right option, some really important questions include, which medication do you recommend? How does it work? How long does it take before I start noticing the effects? What are the side effects? Does this interact with other medications? Will it affect my other conditions? What does it cost? And does my insurance cover it? Questions to ask to ensure you know how to take the medication correctly include, when do I take the medication? How often do I take it? How much do I take at a time? Do I take it with or without food? What should I do if I miss a dose? And are there any special rules for storing the medication? So to learn if it's safe for your baby, ask your doctor if it's safe while breastfeeding, and that can help you make a decision as to whether or not it's safe to continue breastfeeding while you're on this medication. Another thing I would suggest too, in asking questions with your doctor, is there anything they recommend you do in addition to the medication? So there might be certain physical exercises or activities that you can engage in that they would recommend that can augment the effects of the medication. So that can be great to ask about. If you have leftover questions after your appointment, make sure to follow up again. So you can call your doctor's office. You can always send a secure message as well, and schedule a follow-up visit if it really feels like you need to have a conversation around things. You might also ask if they offer telehealth, because life with a newborn can be really hectic and hard, and sometimes that option can make it easier and more accessible to do a follow-up appointment if you have leftover questions.